In a world where mental health is becoming an increasingly important topic, technology is stepping in to transform the way we approach therapy. From chatbots offering support to AI-powered platforms revolutionizing diagnosis and treatment, artificial intelligence is making a significant impact on mental health care. Today, we'll explore how AI is reshaping the mental health landscape, enhancing accessibility and improving treatment. We'll also take a deeper look at the ethical considerations, limitations, and the future of AI in mental health care. The rise of AI in healthcare. Artificial intelligence has been making waves in healthcare for years now, and mental health is no exception. The global mental health crisis, fueled by rising levels of anxiety, depression, and stress, has led to an urgent demand for innovative solutions. Unfortunately, there is a severe shortage of trained mental health professionals worldwide. AI in mental health aims to bridge this gap by offering scalable, efficient, and personalized solutions that can help more people in need. From assisting with therapy to providing tools for self-help, AI is here to revolutionize the mental health space. In fact, according to the World Health Organization, 1 in 4 people will experience mental or neurological disorders at some point in their lives. Yet, many people don't have access to the mental health care they need. Here is where AI steps in. AI-powered mental health tools. One of the most exciting developments in the AI-driven mental health revolution is the rise of AI-powered mental health apps, such as Woebot and Wysa. These apps use artificial intelligence to provide immediate, 24/7 support to users who may be experiencing stress, anxiety, or other emotional challenges. Woebot, for example, is a conversational chatbot that uses principles of cognitive behavioral therapy, CBT, to interact with users and help them better understand their emotions. By analyzing user responses and feedback, Woebot can offer tailored advice and coping mechanisms based on individual needs. While these tools cannot replace a trained therapist, they act as valuable supplements, offering mental health support and guidance at any time of day. Whether it's dealing with a stressful day at work, navigating relationship challenges, or simply needing someone to talk to, these AI tools are always available to provide assistance. What makes these tools particularly useful is that they can work alongside traditional therapies. Some individuals may feel more comfortable reaching out to an AI first, before opening up to a human therapist. This can be especially helpful for those who experience social anxiety or stigma surrounding mental health. Enhancing traditional therapy with AI. AI is also making its mark in traditional therapy, enhancing the way therapists work with patients. Advanced AI tools can now analyze various forms of data in real time during therapy sessions. These tools are capable of assessing speech patterns, facial expressions, body language, and tone of voice, all of which are crucial for understanding a patient's emotional state. Show examples of AI tools in use during a therapy session, such as software that analyzes facial expressions or voice stress levels. For example, AI can analyze your tone of voice or facial expressions to detect subtle changes in emotional states that may be missed by the human eye. These insights can help therapists understand how their patients are truly feeling, even if they're not verbally expressing it. This data can be incredibly helpful for therapists, enabling them to make more informed decisions about treatment. AI tools can also assist with tracking progress over time, providing detailed reports and suggestions for optimizing therapy. Furthermore, some AI tools can help therapists identify underlying issues, such as early signs of depression or anxiety, which may not be immediately apparent to the patient. These tools allow for a more proactive approach to mental health care, ensuring that issues are addressed before they become more severe. AI in diagnosis and monitoring. AI is also proving to be an invaluable tool in diagnosing and monitoring mental health conditions. Traditionally, diagnosing mental health disorders has been a lengthy process, often requiring extensive interviews, assessments, and time-consuming evaluations. Today, AI is making this process faster and more accurate. Machine learning algorithms can analyze vast amounts of data from a variety of sources, such as social media, wearables, and health records, to identify early signs of mental health issues. These systems can track patterns in speech, behavior, and even physiological signals like heart rate and sleep patterns. AI-powered devices like wearables are continuously collecting data that can provide valuable insights into a person's mental well-being. For example, a drop in activity level, irregular sleep patterns, or changes in social interactions could signal the onset of depression or anxiety, prompting early intervention. These tools can also monitor ongoing conditions, alerting individuals and healthcare providers to changes in mental health status. In this way, AI can help provide continuous care, even outside the therapist's office. Ethical considerations and limitations. While AI offers incredible potential, it's important to recognize that there are ethical concerns and limitations that must be addressed. The most prominent issue is data privacy. AI-driven mental health apps and tools rely on collecting and analyzing large amounts of personal data, which raises significant concerns about how this information is stored, shared, and used. Users must trust that their sensitive information is being handled securely and ethically. Data breaches or misuse could have serious consequences for individuals seeking mental health support. As a result, developers must ensure that robust security measures are in place and that privacy regulations are followed. Another challenge is the risk of AI misinterpreting emotions or offering solutions that may not be suitable for everyone. While AI tools can provide valuable insights, they lack the nuanced understanding that a human therapist possesses. AI can sometimes offer generic advice that may not work for every individual, especially in complex cases. Additionally, there's the question of human connection. Mental health is a deeply personal and emotional experience, and while AI can offer valuable support, it cannot replace the empathy, intuition, and emotional connection that a real human therapist brings to the table. The future of AI in mental health. As we look to the future, the role of AI in mental health care is only set to grow. New advancements in AI and machine learning will likely lead to even more sophisticated tools capable of offering highly personalized therapy, better diagnostic capabilities, and deeper insights into mental health. We may soon see AI-powered systems that can predict mental health crises before they occur, allowing for early intervention and treatment. This could dramatically reduce the burden of mental illness on individuals, families, and healthcare systems. Additionally, AI may help to democratize access to mental health care, providing high-quality therapy options to people in underserved areas or regions with limited access to trained professionals. As AI continues to evolve, it will likely play a central role in making mental health care more efficient, accessible, and personalized. But as we move forward, it's crucial that we continue to approach these technologies with caution, ensuring that they complement traditional care rather than replacing it. AI's potential to transform mental health care is undeniable. It offers a new realm of possibilities, from early detection to ongoing support. But like all innovations, it's important to approach it with caution, ensuring that the human element of care is never lost. As we move forward, it's crucial to balance the strengths of technology with the compassion and empathy that human therapists bring to the table. Together, AI and human expertise can work hand in hand to improve mental health care for all. Thank you for watching. Don't forget to like, subscribe, and hit the bell icon for more insights into the world of tech and health. Until next time, take care of your mind.